So when's the best time to have a shoulder replacement? It's typically when all other treatment options have failed, whether it's surgical or non-surgical treatment options, and you're still having pain, difficulty, or inability to do the things that you want to do or need to do. That's typically when we turn towards joint replacement surgery. Medical clearance prior to surgery really depends on the surgery and the age of the patient. Typically, any individual over the age of 50 or those who have chronic medical issues, we typically get preoperative clearance from their primary care doctor, or if they have cardiology issues, a lot of times we'll go to a cardiologist, or any other specific surgeries or specific needs. Sometimes we'll need more specialized clearance. Typically, most healthy individuals under the age of 50, we don't really need medical clearance or any preoperative testing before surgery. For most minimally invasive knee surgeries, we can typically see you in the office and potentially even get you into surgery if needed within 1 to 2 weeks. Most of the time we have some OR availability that we can do these outpatient procedures relatively quickly. For shoulder replacement surgery, it takes a little bit longer to get you into the actual operating room. Typically, we see you in the office, we obtain the appropriate imaging, and come up with a plan. And once we finally decide that you would benefit from a joint replacement surgery, typically you have to go through a joint replacement class, as well as obtain preoperative medical clearance before these procedures. And then we can usually get you in the operating room fairly quickly after that, but usually the total turnaround time is approximately 6 weeks. One of those common questions we get asked immediately is, do I need an MRI? And oftentimes the answer is no. A lot of times, just based on x-rays, good history, and physical examination, we're really able to determine what's going on with you and what the problem is. And sometimes we can avoid a costly MRI and potentially treat you without ever obtaining advanced imaging. So why choose East Cooper Orthopedics at East Cooper Medical Center? I think we have a much more personalized staff, and it's a much smaller location than dealing with a big medical university. We have easy parking, we have easy access. We usually can get you in fairly quickly. We're close-knit with our staff and our physical therapists. We know each other. I frequently will pop by physical therapy and see how my patients are doing, or if physical therapy has issues, they come over and they walk right next door and they see me in the office. We stay in really close contact with our patients as well as our staff. We have a great surgical staff here at East Cooper, from the OR staff to the pre and post-operative nurses. We have great anesthesiologists that do fantastic jobs at keeping people pain-free and comfortable and getting people through surgery very easily.